Fibroids. Okay, this one is personal. I have a fibroid. I have one that's been removed. And man, did it cause me a lot of headaches. But what is it? Do you have them? And if you do have them, what are you supposed to do about it? Let's talk about that. So fibroids, they're quite common. A lot of women have them. A lot of women don't even know that they have them until they try to get pregnant and it gets in the way. Unless you're unlucky like me, they don't typically cause pain. However, in severe cases, depending on size and location, they can cause pain. That's what happened to me. I had a 7-centimeter fibroid on my left side that was wreaking havoc on me, and once I had it removed, my pain went away. But what is a fibroid? Well, they're benign tumors. So pause on the tumor. The definition of a tumor is basically just a growth. Benign means that they're not cancerous. So they're not going to turn into cancer. It's very, very rare if they do. And they don't cause any of those types of symptoms that a cancerous tumor would cause. I know that can sound kind of scary, but keep listening to this video because knowledge is power. Fibroids can also be called uterine fibroids or leiomyomas. The surgery you get to remove them is called a myomectomy for that reason. They're non-cancerous growths that develop in and around the uterus. They're made up of muscle and connective tissue and can vary in shapes and sizes. They can be tiny, tiny, tiny like a seed, or as big as mine, which was 7 centimeters, like the size of a grapefruit or softball. Like I said, they typically aren't cancerous. However, they can cause symptoms and can affect fertility. So let's talk about types. There's 4 types. Number 1, intramural fibroids. These are the most common and they develop within the wall of the uterus. They can cause an increase of the overall size of your uterus and lead to very heavy periods. Number 2, subserosal fibroids. These grow on the outside of your uterus and can cause issues like putting pressure on outside organs. Number 3 is a submucosal fibroid. These form just underneath the inner lining of the uterus, and these are the ones that typically will cause issues with fertility as they are taking up space in the uterus. They can also lead to heavy periods. The last type, number 4, is a pedunculated fibroid. This was actually what I had. These fibroids are attached to the uterus by a thin stalk. So it kind of comes off the wall and then grows over here. That's what I had on my left side. It was kind of hanging off the left side of my uterus and compacting all of my organs on my left side. But I also have a submucosal one on my right, which is nice and tiny, so we just left it alone. So how are fibroids treated? Medically, a lot of the times they are just left alone. If they're not causing any issues and you're not trying to get pregnant and they're affecting that, a lot of women don't even know they have them. This can be called watchful waiting. Basically, we kind of just keep an eye on things, see how your symptoms are if you have any, and get imaging updated regularly. There are medications that you can take, most commonly birth control. This can just help manage symptoms like heavy periods and painful periods. A word of caution though, informed consent is really important when you're taking these medications. I highly recommend reading sources like anything by Dr. Jolene Brighton. Her book Beyond the Pill is fantastic to really know what getting on the birth control means and if you're willing to take those risks. We can have minimally invasive procedures. Technically, that's what I had. I had a laparoscopic surgery where they just kind of cut, little scars and inserted robot arms to kind of cut everything out and pull it out. You can also get things like ablation, which is when they burn things off. Those can help in regards to removing pressure or if you are having heavy periods or they're getting in the way of your fertility. Hysterectomy is a common recommendation for a fibroid if the female is done having children, no longer wants to have any more, or never wants to have children, or it's really that extreme that they're willing to kind of lose their fertility in order to kind of, not deal with the symptoms anymore. A hysterectomy is an option. And the last thing that most doctors might not necessarily recommend, but holistic practitioners will, is lifestyle changes. There have been many cases where women will report that by changing certain things in their lifestyle, they've actually reduced their symptoms. Whether that actually impacts the sizes of the fibroids, no studies that I know of, I'm sure I'll go looking for them, have said that they can shrink them, but it is something that if it can help control your symptoms, why not give it a go? This includes things like, of course, diet, exercise, stress management, and those sorts of things. Now that's a lot of information, and the right treatment plan really depends on the kind of symptoms you have and how far you're willing to go. My personal story was I was having extreme pain. It was really impacting my life. I wouldn't exercise because I was in so much pain. I also got diagnosed with endometriosis when I had the surgery for my fibroid removal, so I got that information as well. And when you have something as large as I had, just the pressure alone can cause a lot of issues. I'm very lucky. I'm a year out from my surgery and I haven't had the pain return, knock on wood, but it's not always a given that having the fibroid removed will cure everything. A lot of women will have fibroids also return or grow if they've shrunken them somehow. It really depends on your hormones, your lifestyle, and sometimes they just do that. For me, the reason that they were kind of, wanting to get me to remove the fibroid from the pain aside is because I'm young and it grew really fast for my age. It wasn't there and then suddenly it was. So it was one of those things that my body just likes to make things it shouldn't, and it makes it really fast. So I can go from feeling great to having pain pretty suddenly. So getting something like that removed was actually really beneficial in my case. Now, don't get me wrong. Lifestyle changes are something I'm working on too. Because I do have endometriosis and PCOS in addition to fibroids, they're even more important for me to do. I'm also on an IUD to help control the pain. So that was a lot of information about fibroids. I hope that helped. If you have any other questions, I will do my best to answer them in the comments below. Otherwise, I will see you in the next one. Bye.